This is Connecting the Thoughts, a place where women in health and leadership come to reconnect to their body, their truth, and their story. I'm your host, Megan, nurse, health and wellness coach, and creator of Rhythm Wellness. This podcast is a place to explore the stories behind strong women, the stressors they've carried, the pivots they've made, the ways their bodies have spoken to them, and the somatic practices that have brought them back into rhythm again. Today, I am joined by Juliette from the Terra Wellness. Welcome.
Thank you.
Thank you for being here. Hello.
For having me. Hi.
It's such an honor to have you here.
Thank you so much for
Thank
having
you.
me.
I'm like, I know we just met recently, and I'm so excited for us to be able to connect and just have a nice little sit down and talk and get to know you more and what you do.
Yes.
And what brought you to the Tampa Bay area?
Work. Basically,
work.
yes. And I was told this is the happiest city in the USA. I'm like, why not?
Yeah, it is a happy
Yes,
city, isn't it?
is.
Have you been loving it so far?
I am. Food, nature, everything. Ocean, half an hour drive.
Yeah.
And I love the little downtown they have. It's so gorgeous.
It's so like livable, right?
It
Like
is.
life. There is
It
life
life
here.
and
It's
happiness and nice.
Yes, I literally always am telling people, I'm like, it's just a little slice of heaven where you can go and you can do whatever you want to do and you can have fun and enjoy yourself. And it's a perfect place for it, isn't it? It's a perfect place. How long have you been in Tampa for?
A little over a year now. Few days. Yeah, last year. I
Happy
moved
1 year
here. Thank
anniversary.
you.
Awesome.
Thank you.
Where were you
you
before Tampa?
I was between Orlando and Ocala, traveling for work for a year, and before then, all across the globe, basically, doing my training and medical school and residency and all those stuff.
Totally. What brought you into medicine and wellness?
Since I was 9 years old, I wanted to be in medicine. I remember vividly waiting for to be picked up from school, and thinking deeply that how fascinated I am by mind. And I picked the major in biology during high school and pre-college.
So cool.
And there I was introduced to a lot of different majors. Medicine was something that really, really was calling me.
It was speaking to you.
It was like both ways. Until this day, this is it.
Awesome.
This is such a beautiful place to be, and I'm so grateful I choose that path. I'm so grateful that I get to do this.
Yes, and we're so happy that you get to do this, honestly. Now, when you say you love biology and that's what kind of brought you into medicine, was there anything specific about it that intrigued you? Or was it just kind of like, I like this and I want to explore more of it?
So back then, what I love was brain and how our thoughts process is working. And how it's connected with everything else. Like simply even solving a math problem, putting my schedule together and communicating with everybody. Like everything was just going up here for me. And that's what drew my attention. I was like, okay, how can I
use this?
Deeper? I'm like, okay, biology it is. And oh my gosh. Anatomy of the brain, physiology and everything. It's just everything fall into place. And this feels so natural.
It just like it worked out exactly the way it should. And one little trickle led to the other. So then you went into medicine from biology. And where did you start with that?
So after high school, we take 1 year of pre-college. It's like a very back-to-back courses. And then if we pass entrance exam, we get to do a medical school, which is 7 years right after, like a year after high school, basically.
Okay.
And then I did my medical school 7 years. And then 2 years after that, I had to work and serve in rural areas to be able to like get my license, etc. And then these are all back in my beautiful country, Persia.
Okay. Yes. I was going to ask you where you're from originally. Yes.
Yes, I'm from Shiraz.
Okay.
Persepolis, if you're familiar with.
I'm not too familiar, but I would love to know more. I would love to know more.
The entrance of the first empire that was ever built 2,500 years ago is Persepolis.
Okay.
I'm born like 45 minutes from it.
Oh, wow. That's so awesome. That so very much resonates with you then. And
it does. It
totally.
does. And I do feel everything that, my ancestors served and did. And while I'm studying the history, I realize how great they were back then.
Yeah.
And for a while, they lived in a golden age. And that just speaks to my heart.
Yeah, it speaks to who you are and what makes you you. That's so beautiful. Thank you for sharing that. I did not go to medical school, but obviously nursing school, right? So tell me how stress was for you, dealing with it in nursing, in nursing school, going to medical school.
So to be 100% honest, I didn't know how stressful it's going to get.
Okay.
I just know I love medicine.
Yeah.
And I want it, and I'm going to go get it. And then after accepting and then doing internship and residency, the only really difficult part was 30 hours shift in a row. Waking up at 4 a.m., being in the hospital at 6, and then going back home between 9 to 1 p.m. the day after.
Long hours,
and you have to be at your A+. Everything, mentally, physically, everything. So those are something I wasn't prepared for. And deep down, I don't think the best physicians are those necessarily who can stay up for 30 hours.
Right, yeah. That necessarily doesn't benefit people in the best way that it could. No. I completely agree with that, very much see that. And that's where I kind of come from too, asking about your stress, because I see you guys all the time, or not anymore, right? But I would see residents and they come in and they are dog tired and they're working on 24 to 30 hour, and where they're at and knowing where their tip top is at, you can tell there's such a difference. And it's I can see how they're holding that weight, right? You just see that physical. So what were some outlets that you utilized for that? When you were dealing with that, and of course you don't have that much time, right? Because you're dedicating it fully to the hospital. Do you think your cultural background inspired that? Or do you think that there was different ways that helped you to navigate those stressors?
I feel like it was biology that helped me.
Yeah, just understanding the practice. Yeah.
Biology. And, we have certain capacities.
Yeah.
And if we voluntarily expose ourselves to something that is difficult, gradually few genes will turn on that would have never, if we wouldn't been exposed.
Yeah.
I feel like, okay, this is difficult. I wasn't expecting these long hours. So I have to deal with it now.
Yeah.
Gradually, every shift, I would just mentally prepare myself and try to breathe in and stay in the present moment and do one step at a time.
Yeah.
And sometimes when I had really good co-resident, co-attending, and great team to work with, I was exhausted and tired, but I felt so fulfilled. And those times that I was feeling those fulfillment was enough for me to continue, for me to be so happy. Almost always when I leave the hospital, my heart is full.
You're grateful for the experience and to be able to do something that you genuinely love and are so fascinated by. So that is wonderful. That's so beautiful. Helps. But that definitely speaks volumes too about when something is aligned for you, right? And you do want it and nothing's going to get in your way, but also listening, right? Because that forced you to listen to your body in a different way. Biology, but now you're kind of applying biology to what is it doing with me and how do I navigate this? It's so wonderful how you dealt with that, because to keep the half cup full mindset too, that's not easy.
No,
that's not easy.
It's not easy. It's not. And I would say one other thing that contributed to this was learning courage.
Yeah.
from my attending, from the senior resident. I would see them. I see how they're functioning, and I was like, okay, I'll follow this path. And courage, we also learn courage. It's not just there. It's not just there. So
you work through challenges.
I just look at them and I was like, okay, I'll behave the same way.
Yeah, like I'll just follow. You're successful, right? And you're making it happen, which means that it can be done also. That shows you that like you're not doing this for nothing. There is a rhyme and a reason for it. So beautiful and so awesome that you had attendings and like higher ups that you were able to look at as role models, because I would dare to say there's probably like a 75-25, right? Where like a lot of people do get that experience, but there's also a handful of people that do not get that experience.
We might get into it.
Yes, later on. Yeah, I'm like,
all goods and all the challenges too.
Yeah. Absolutely. Yeah, absolutely. It is like that. So tell me, how was it when you started becoming a physician then? Did you notice like from practicing, right, and still having an attending over you and getting to go through that process and learning courage, right, and being able to get yourself through that, how would you say that translated into you as you became a physician on your own and started working on your own, right, and not necessarily going to the attending to have as, yes, there's still role models there for you, but you're also doing your own thing now, right? Like you're one of them, if you will. So, did that, please?
It was the transition, I would say, it was not easy, but that was what I wanted, and I didn't even hesitate for a second to not enjoy it. And I fully embraced that. The other thing is that even during the transition, our mentors are available. So if I have any question, I just call them. And they're available to respond.
They can come to you. I see the salon surgery.
So they tapered the transition so smoothly that I'm like good now.
Like you felt completely fine to go on to your own, and that's beautiful. You said you did general surgery, correct?
General surgery, yes. In Brooklyn, New York.
Okay.
Yes.
Yeah, that's its own thing in and of itself. I'm from New York, so I totally can relate to that. Not the city, but upstate New York. And so I definitely get what you mean. And New York is a different breed. It's a different,
It is absolutely a different breed, but I fall in love with it.
Yeah.
The city. And I have never fallen in love with any other city in my entire life.
That's wonderful.
I obviously love my country, the Shiraz, the city I'm from, but New York was just, oh my gosh.
It's a spectacular city. How long were you there for?
For over like 3-4 years.
Oh, wow. Okay. Yeah. So like a decent amount of time for it to be like home. And so then did you transition from there to Tampa? Is that when you transitioned?
After that, I applied for surgical plastic surgery fellowship, and I matched in Columbus, Ohio, facial plastic surgery at Smith's Facial Plastic. The fellowships, they're all through private practices. And there I did 1.5 years of aesthetic surgical and procedures, and still very challenging, but a la land. In compared to general surgery. Every night, I went home. Patients always stable post-op, and I slept.
So like the stress was not affecting your sleep there, but like so apparent too in that shift. Do you think that's what kind of led you into going into plastics, or were there other things on the cusp when you were in New York that kind of guided you right to go into plastics?
Where should I start? I would say I'll go back from New York to LA. I was doing research, neurosurgery department. With Dr. Betty at City of Hope. I was doing basic science research, and in combination with shadowing him in the operating room and clinics. And as you know, brain was my passion. Everything I always wanted. But I have 1,000 desire, and the whole aspect of medicine is appealing to me. There, my mentor there, the chairman at City of Hope, he said, future for general surgery is better. Quality life is better, and apply there at the same time. And then I matched in GenSearch.
Okay.
Yes.
Okay. Yeah.
So GenSearch is what I matched, and very, very challenging for me personally.
Okay.
But again, that's where I would say half of the attending and resident, they were just piece of heaven, like the greatest soul that anybody could ask for. The other half, not so much.
Yeah. That's been at 50-50, right?
Yes. GenSearch 50-50. For me, although I would like to get to the other 50 as well, very non-judgmentally. And then while I was doing my surgical procedures, I remember even at 3 a.m. after 20 hours shift, closing a skin, everybody would comment on me that's how gentle I am with the soft tissue, and I'm doing a plastic closure because general surgery, they just get the job done and close the skin and leave.
Stitch it up and we're done. Yep.
Yes. Yeah. But I was doing that, and I would get good feedback on plastic surgery rotations. I was like, okay, this is it, less stress. And I love that. And I love doing procedures.
Yeah.
Very much.
Awesome. That's so exciting. Exciting.
So my GenSearch training shifted my focus to plastic.
Okay.
And I loved it.
Yeah.
I absolutely loved it. During my training in Columbus, Ohio at the facial plastic surgery fellowship, it was a clinical and research fellowship.
Okay.
There, I got introduced to many laser technologies.
Yeah.
I love technologies, how those can also help make you look good and feel good and regenerate. And that
to support the good stuff going on inside. Yeah.
I just love those as well. And it will be implementing those as well to my practice.
Yeah, I was going to ask you, I wanted to know more about your full body scans that you do and how that kind of reflects and integrates with preventative health, right, and proactive. So please.
Will do. So after moving to Florida.
I was about to say, we can go back and forth however you want. Yeah, please.
So my full body scan, the story started when I moved to Florida.
Okay.
I was working with also a semi-retired plastic surgeon across the door. It was a wellness center. The physician there introduced me to information and frequency medicine.
Awesome.
And in the past 2 years, I'm educating myself on that topic. I'm attending a lot of conferences with other medical peers of mine, globally and locally as well. And also some physicists to understand the concept of information and frequency medicine.
Yes.
It's such a fascinating topic.
Like, I just want you to keep going because I am.
Yes, it is. This whole element, I feel like our body, this physical body that we touch and we feel, it's 1%. The more important is the quantum physics around us, which is 99%. And we can treat and touch and heal this body. Modern medicine, I absolutely love it. But I feel like what could potentially be even more impactful is the quantum physics. It's balancing those quantum physics around us, and and healing that way. And my body scan is based on information and frequency medicine, which I love so much.
It's so exciting, isn't it, to just know that we're not just this physical body. And that also leaves room that there are things that can be done, right, to help you feel better when you think that there's not much left there you can do, or like you don't know which direction to go. There's a whole nother layer that you haven't even necessarily touched yet.
Exactly.
And you don't even necessarily know what balanced is going to feel like until you do touch that layer. So that's so exciting. Exciting. What has been kind of your like favorite part? This is a little like, I guess, a different type of question, but what has been your favorite part that you've learned about radio frequency? Like, what really sticks out to you? I know the quantum physics and all of that, right? But like, is there something specific that points out to you that like you see it work, right? And you're like, this is it. Is there anything that comes to your mind?
It might appear that it's the very basic, but what I've seen that actually worked and make a difference is balancing all the chakras.
Yeah.
It is so powerful because those are the energetic alignment and frequencies, and they hold the most power. And when they are balanced, everything else fall into place.
Starts to work naturally and just the way it's supposed to actually be working for the body.
It is. And it gets affected by injuries, by radiation, by toxin, by food dye, by even negative head chatter. It get entangled. And when this is must, if we are able to release the blockages so energy can flow.
Yeah. So that you can actually
see results. So removing the scars, removing any sort of blockages.
Yeah.
That's where we see the result, because we can keep treating and try to heal, but when the scar is there, it won't heal.
Yeah, it won't do what it needs to do, because there's almost like not a Band-Aid, but a Band-Aid on top of it. The body made naturally, but it's still nonetheless a Band-Aid for what was naturally there. Yeah.
I love that. Yeah. Yes. For the most part, the body made it naturally.
Right. It tried to do what it needed to do, but at the end of the day, it's not that natural first layer that we had. And so, no, I love that. This is so beautiful. Thank you for sharing that. I'm like, it's so fascinating talking about energetic work, right? And our chakras and alignment. Because as you move your body now, right, like it starts to flow, and balancing those chakras allows you to move more efficiently, right? Like that is what we all want. We want to feel better in our body, and we want to move our body. So what have you tried within this? Like, what are some of your experiences using radio frequency for yourself, if you have it ever, or some practices that you have done to align your chakras, right? And just different work like that.
Yes. So alongside our body scan, we have the actual device as well.
Okay.
The frequency, we have a mat that goes on your spine.
Yeah.
And the other mat, it can go in any part of your body.
Okay.
And we basically run the frequency first in like a program that remove the blockages.
Yep.
And then we have balancing and unblocking chakras.
Okay.
Those I have done.
Yeah.
And oh my gosh, the feeling while doing that treatment.
Yeah.
It's just so blissful. Like that was the definition of feel good for me.
Yeah.
Nothing had made me feel so good in regards to medicine.
Yeah.
Apart from that, so that I have done, which is available in my clinic. And also meditation.
Okay. Yeah.
Believe it or not, like 3 years ago, almost at the end of my facial plastic surgery fellowship, if you would talk to me about meditation, I was like, no, I don't meditate. I'm doing just fine.
Okay. Yeah. I was going to ask how this, when this came into play. Yeah.
Yeah. I was like, I got this. Why would I need to meditate?
Yeah.
And I came across an ad, Ziva meditation.
Okay.
Emily coaches that.
Yep.
And it really spoke to my heart.
Yeah.
And I was like, I'm going to sign up for this. I did. I followed her meditation practice. And oh my God, it's so amazing.
Yeah.
It just cleans your body and release all those
all the things that are not serving you. Yeah.
That it feels so good. So another thing I've done is meditation that is effective.
Yes.
It does work. Some individuals, they get so higher in their spiritual work that they're walking meditation. They don't necessarily need to sit down and meditate. But I feel like I'm still at the state that I need to sit down.
That's how I am. Yeah. It was, I think it was 2022 for me where I really started to it was one of those things where I was a nurse and I was meeting a lot of holistic and wellness people and different types of coaches and stuff like that, right? And I saw the work they were doing. And they looked so free from that mind chatter, right? Like I would always hear about the monkey mind and was kind of more curious, right? And then just like you with biology, I kind of let it deep dive in and started doing the work right. And then starting to see how that work impacts. And it is so powerful, so powerful. Do you kind of, when you have your clients that you are going to here and there, do you have them meditate, or do you like inspire them to kind of touch into this at all? Yes. Or how do you go about that?
I do, yes, my very best to encourage them to meditate, and I follow up with them. Are you meditating? Sometimes I ask, if you would like, I'll send you text messages to remind
reminders.
You
I do the same
meditate.
thing.
Yes.
I love that.
And I would also encourage them to like do something to feel good and then sit down and meditate. Hot bath is really good. Take a shower. Water just cleans you.
Just a little cleanse before something to like before you sit down into it to get to it. Yeah.
I do encourage them every single day, and deep breathing exercises as well.
Ask about breath.
Yes, we have a vagus nerve at the back of our throat. Deep breathing stimulate that, and that's what put us to parasympathetic. The rest and digest, you don't need a doctor's order. It's at your service, ready to be used, and so effective.
It's probably one of the most effective things that we take for granted, right? Because we stop thinking about it. We're doing a million other things, so we don't even focus on our breath. But if we realize the power that it does have, and also that a lot of things are stemming from stressors, right? And so when we start to be able to practice to calm our own bodies down, that right there is nature's gift to us, right? Like the beauty of it.
It is a gift.
That's how you kind of dived into wellness then, right? Yes. Like starting with that.
Yes, and it's the basic.
Yeah.
It is absolutely the basic. Like I love to also look good.
Yeah.
And I love all aesthetic procedures, but that would partially bring happiness, but it doesn't bring the deep down calmness and happiness. We've got to do the inner work.
Yes.
We've got to connect with our creator, if you will, to be able to heal. And I feel like medicine is mental health, physical health, and spiritual health.
All of
them. We cannot skip any of them.
No, they're all necessary and pertinent. I'd love for this to spin it back a little bit back to being a physician for a second. Yes. Did you notice where this was super apparent, if you will, with your patients? Like seeing when you have a patient in there and they're dealing with stress, right? And how they're dealing with that and how everyone else navigates and deals with that stress. Were any like little, I guess, like connecting the dot, right? Like was anything kind of going off where this is also like this and this is like this, and it's stemming down more to an energetic level than it is a physical like level?
Oh, definitely. Like a lot of even complaints in regards to the appearance.
Yep.
It just not always there. That I'm just talking about a very small percentage. But in other aspect of medicine, like individuals that they cannot sleep, they cannot be in a public setting.
Yep.
All of those constant meditation, constant remembrance to connect with the heart and connect with the spirit realm. Those helped them a lot. And in the past 2 years, I had so many success that that it's just honestly, I wake up and they fill my life with so much joy. The result
very much so. And it's so rewarding when they're coming there to do something that's so healing for them, right? Which a little different from plastics, if you will. It's so awesome and it's such a beautiful thing, but this is like a little different layer and line of work, a deeper layer, if you will.
Deeper layer. Fortunately, back home or here, we weren't trained on information frequency medicine, but it's out there and I'm educating myself on it, and I'm inviting everything in. And if it makes sense for me and if it makes sense for my patient, we'll do it. It's just an agreement between us, and I'm in medicine, like I would say in human mind, nothing is 100%. We don't know the absolute answer, but a lot of things feels right. Will feel so right that we cannot dismiss.
Right. We can't deny it either because it feels like it is the exact moment in time we're supposed to be there.
Yeah. And I feel like a wellness fits so well with aesthetic.
Yeah, it really does. They go hand in hand. They're so in line. They're so in line. I think this all the time when I kind of went one way with doing more somatic work, right, and different exercise modalities. But that world has always fascinated me as well, which is why I love connecting with you, right? Because this is where I also get a piece of that world without necessarily being that, like, if that makes sense, into it. But it's so beautiful. I love this so much because the work all relates back to how is the mind and the body connecting and how is it finding balance and center, right? And there are so many different ways that we can achieve that, but what feels right for your patient. And that's where you can give them this radio frequency, right? And these sessions that can help them to be able to find balance in their body. So that's so beautiful. It's so beautiful. I love hearing about all of this. So how would you say that most of your patients are coming into you now? What are they looking for when they come to you? Are they looking to manage stress? Are they looking to kind of make a change in their lifestyle? How do you feel like they're coming to you?
So it's now a variety. They're mostly coming to me to feel good.
Yeah.
And it could be in any setting. Feel good about their work, feel good about being here in this lifetime, being able to sleep well. That's the majority of my wellness patient. However, a lot of individuals are now I would say smart enough to do preventative care, not let it accumulate.
Right.
And just, we go clean our teeth twice a year, but we forget to clean our spirit.
Yeah.
We sometimes, in regards to like aesthetic, we sometimes forget to take care of our skin. So it's so important to add those elements to our life as well. So the aesthetic patients, they like fine lines or whatever, that's what they want, and I offer that. And despite loving wrinkles, I absolutely do. It reminds me of my amazing grandmother, and I think it's just so beautiful. But if you want it out, there are ways to take care of it.
You're about making someone feel their best. Like you just want them to feel good.
And healthy. A lot of those laser technology that makes your skin quality good, and it's important.
It is. Your skin is one of the biggest organs on this body. We need to take care of it. Absolutely. So we're getting into more preventative health. What are some areas that you would say that you use in your own life to kind of navigate through that? And
so I would say food is our medicine. Whatever we eat, we feel. And it's so critical to be religious about what we eat. I would say 80%, 20%, just have fun and enjoy yourself.
I love that. I'm very same vibe. Keep going. I didn't mean to interrupt you. Sorry.
No, all good. I would say feeling good. And another preventative care is to building good human connection. Number one cause of longevity based on few studies is not diet and it's not exercise. It's good human connection. It's so critical.
We underestimate the power of that. You can be fine on your own and that's all fine and well until it's not, right? Until then there's so many other things, right? Where having someone else in a connection can just foster your health. It's support, right? Having that support team. Very much like how when you were a physician and you had your attending, it's the same layer, right? Like when you have those people in your corner, some things may not necessarily go the way you want them to, but when you know that you're not alone going through that, it makes it so much better.
So much better. So much better.
So I want to ask you, what are you doing in the Tampa Bay area right now with clients? Besides how you're treating these clients right now, are you kind of doing anything else in proactive and preventative health?
So the main thing I am doing is the frequency and information medicine. However, we are adding exosome, IV treatment, stem cells that are, again, nothing in medicine is 100%. I want to look at the camera and say that, but the results have been so powerful. And I've been told that Medicare insurance soon might approve administration of exosome. And that's such a great step forward. Huge forward. And other than that, it's available for anybody who would like to use that. And those are key modern medicine. Like, that's why I love modern medicine. These are part of what are out there to help us. That is
actually going to help us to be able to help everyone else.
Exactly. So those are also very powerful, very potent. Longevity and anti-aging and feel good.
All the things we need. All the things we need. Would you say that your clientele is, what age range is your clientele? All clientele, or do you get a little bit like mid-age, later in life? What would you say?
I would say majority are in their 40s and 50s, but I do definitely have younger than that, and older too, like
So when they want to come to you, and I'm getting curious about age range here, right? For like the little details, but when they come to you and they want to feel good in their body, are they already doing things that you notice in like preventative health necessities, if that makes sense? Like, are they already doing practices that would be proactive, or are they coming to you and have no clue kind of where to even begin? And that is the place that you step in.
I actually see a lot of varieties. Some they have had practices in the past and they completely quit that and like got busy at work, had to travel for this and that, and they stopped their routine and now they're in chaos and they want to like get balanced and grounded again. So they kind of know how it is. They want someone to hold their hand, and I'll be very happy to be that. And that's one aspect. I have had some patients that never included any meditation practice. It never included any preventative health care. And those are where I try to introduce them. Even a lot of my colleagues, they don't incorporate or even know much about the stem cells and exosome and longevity treatments that are out there. It's shocking, but they don't. They are those. Like I would say, not everybody is diving deep in that. So education is very important. And I have some clients, they already know, they've done their studies, they're so smart, they know what they want, and they're
just ready to rock and get to it. They're ready to it. So this is so wonderful. I love hearing about this. I love hearing about all of this. I want to dive back into a little bit, swing back around with radio frequency here and talking about chakras. Is it evident to you when the patients come in then? Do you notice that they're like how the misalignment is? Can you already feel it before they come into the room, especially now that you're using radio frequency, right? Are there little subtleties or like signs that you see that like you just notice it? You notice it as soon as they walk into the door.
Yes, those are like real expert to just look at you and know where the imbalance is. And I hope I get there.
No, I was just curious. I was curious.
But I do read body language very well, and I give feedback, and I'm so honest and genuine. So far, every patient or clientele of mine are so receptive to my feedback, and it's back and forth, and sometimes I'm like all ears, like I have to hear you completely and listen to you, and sometimes while they're explaining to me, they answer their own questions just by explaining what is going on. And
that is even why I like keep using the word powerful, but that is a very powerful moment when that's where you really are the guide, right? And that hand holding kind of comes in, but in a tasteful way that it's like, you did know this, you just needed to work through it and have someone there with a support, right? Or a connection that helps you to feel safe, right? Safety is a huge thing that I teach about with nervous system health. That's that parasympathetic, right? We can't calm down if we don't feel safe. And so that is so powerful. Again, I'm using the word powerful so much today. I'm like, but power is so, it's just so, that is the weight that it holds. It is power, and it is so beautiful to be able to touch on that. I kind of was asking about that too, if you see that, because I notice a lot of times when people come in to me, where I see it is like the rounding of the shoulders or the shrugged up shoulders, right? Where they don't even realize it. And so even first in teaching like a grounding technique or anything, to just come back into the posture and come back into that body. And so that was just where my question kind of stemmed from. Does that help you, I guess, more so, and how you would do your treatment is where, how you navigate the treatment and how you would be helping them, right?
Definitely. Posture, body language, their response to any little stressor that happens. Watch in my follow-up videos, asking questions in regards to everyday life, and they while they're explaining, I would realize how they respond to everyday stressors, and those respond help me. And the body scan is just full head to toe scan all that gives us such great guide too.
So do you think that kind of was your intrigue too into radio frequency? I know we had biology, but then like your own experience, even going in to be a physician, right? And now transitioning into this, like to realize the work you're like doing yourself, right? And what's going on in your body. And then to see it's like radio frequency was biology again for you almost, right? It was a new wave of something fascinating to find out about.
It is so fascinating. So fascinating. It is like a little bit, I feel like beyond us, beyond our physical touch and vision. And it's something that spoke to me and resonated with me so much. And I want to say, even more than medicine, what draws me, what I'm seeking is its concept of spirituality, the concept of spirit. And I feel like this quantum physics and quantum entanglement and those alignments speak so much.
They do.
With those. And I feel like the bigger aspect of my passion, like the actual part of my calling was that. And medicine fall into that category. And honestly, the minute I graduated and I started my practicing, I'm just reading books in regards to spirituality, in regards to the anatomy of our spirit, not just our body, in regards to and then frequency and information medicine. Like I love physics so much. And those are so fascinating.
They're so
and
cool.
Unknown.
There's so much potentiation that is not even discovered yet. That in and of itself gets you so excited to want to keep learning more, right? And to keep diving into it. Thank you for sharing that.
My pleasure. Thanks for having me.
I'm so happy you came here. I'm like, I know there's going to be more conversations like this, and we're going to dive even further. So I guess what would you say right now is the biggest way you're trying to serve the community, or what you're trying to do in the community right now? But with the radio frequency and stuff, right? But like that deeper message is connecting spirit, or is there anything else that you'd like to touch on with that?
Yes, I would say the deeper message would be, we are here to liberate our soul. We don't live here. We are transitioning through this earth. I love taking care of this gift of the body, and what I do that through in my practice, in my medicine, medical field practice, at the office. But I think what is the most important and what is the most meaningful is to do the steps to liberate our soul and get closer to our creator. I think if I can be a vessel to help individuals achieve that, I'll be very grateful. And myself.
Yes, I love that. Same, likewise. The vessel. I love that you said that, because this is a vessel for so much good, and to be able to use it and make it feel good, and then help others feel the same way, as again that transcending and getting to where you're supposed to be. So beautiful. Thank you for sharing everything today. I know that we're going to dive in even more. I would love to invite you, if you so would. We're going to do like 30 seconds, and I'm just going to do a quick little grounding moment with us, okay? So
please,
you can leave your eyes open or close, whatever you like. I'm probably going to close my eyes.
Same here. I do too.
And we're just going to take a nice, slow, deep breath in through our nose here. And exhale out of the mouth. And I want you to just notice your toes on the ground. Notice your legs on the chair. Notice your back. Breathe in one more time. Exhaling a little longer. We're going to take one breath in, grateful for this conversation. And exhale out through the mouth. And when you'd like, you can open your eyes. Yes, thank you. Is there anything else you would like listeners to know?
That is all for now, and I'm sure we are going to have way more conversations. Yes, thank you so much for joining in. Thanks for having me.
Yes, thank you for being here. One last time, where can they find you at?
My office is downtown Tampa, 400 North Ashley Drive. I love that circular building that says South State. I'm on the 19th floor. Come say hi.
Awesome. Beautiful. Thank you for being here. Thank you for listening. If this conversation resonated with you, you can find the full episode on YouTube, Connecting the Thoughts. See you next time. Yeah.